Every single day, millions of people look in the mirror and see the same thing. A neck that used to be firm, now folding into horizontal lines. Skin that used to be tight, now draping loose under the jaw. A chin that's multiplying. And the worst part, it happened so gradually that you didn't notice until one day you took a photo from a certain angle and thought, when did that happen? 42 million adults over the age of 50 are walking around right now with what medical literature calls platysmal banding and submental skin laxity. Most of them think the only solution is a cosmetic procedure that costs anywhere from $8,000 to $15,000. I'm going to tell you why that belief is not just expensive, it's incomplete. And I'm going to show you exactly how to reverse visible neck aging in as little as 2 weeks using nothing but targeted muscle activation that takes 5 minutes per day. Subscribe to Dr. Waterling right now and hit that like button. We're working toward 1,000 subscribers, and we're building this channel on one principle. The healthcare industry profits when you feel helpless about your own biology. We profit when you take control back. Everything you're about to learn, no plastic surgeon is going to mention during a consultation because there's no billing code for teaching you how your own facial anatomy works. Look at your neck right now, before you do anything else. Place your fingers just under your jawline and press gently. Feel that? That softness, that lack of resistance? I see muscular atrophy. 15 years of clinical practice, and I have watched the platysma muscle, the broad, thin sheet of tissue that extends from your jawline down to your collarbone, deteriorate in real time on patients who had no idea it was even happening. Here's what nobody tells you. Your neck is not sagging because your skin got old. Your neck is sagging because the muscular foundation underneath that skin has weakened, thinned, and lost its structural integrity. And the moment you understand that distinction, everything changes. Because skin you cannot exercise. But muscle responds to load. Muscle adapts. Muscle rebuilds. Let me explain exactly what's happening inside your neck right now. The platysma is a superficial muscle, meaning it sits just beneath the skin with almost no fat layer separating the two. It's roughly 2 millimeters thick when healthy, about the thickness of 2 sheets of paper stacked together. This muscle doesn't just sit there. It's actively holding your lower face and neck in position against gravity every single moment of every single day. After the age of 40, you lose between 1 and 2% of muscle mass per year if that muscle isn't being used. The platysma is one of the least used muscles in your entire body. You don't chew with it. You don't speak with it in any significant way. It contracts minimally during normal daily function, so it atrophies, it thins, and as it thins, it loses its ability to support the skin above it. Here's the physics of what happens next. Imagine a tablecloth draped over a table. When the table is solid and firm, the cloth lies smooth. But if the table starts to collapse, if the structure underneath weakens, the cloth begins to fold, to wrinkle, to sag in the exact pattern of the failing foundation beneath it. That is precisely what's happening on your neck. The skin isn't the problem, the foundation is the problem. But it gets worse. The platysma doesn't fail uniformly. It fails in vertical bands. You can actually see this if you tense your neck in the mirror. Clench your jaw and pull the corners of your mouth down. See those vertical cords that appear on either side of your throat? Those are the medial edges of your platysma pulling apart as the muscle weakens. In medical terminology, we call this platysmal banding. In plain language, it's your neck announcing that the muscular structure is collapsing. Now, when you walk into a plastic surgeon's office with this complaint, here's what happens. You sit down, the surgeon examines your neck, and within 3 minutes, you're looking at before and after photos of neck lifts, platysmoplasties, submental liposuction. The consultation is professional. The photos are convincing. The price is staggering. What that surgeon will not tell you, because there is no profit in it, is that the platysma is a skeletal muscle. It is voluntary. It can be trained. It can be strengthened. It can be rebuilt through targeted resistance exercise the same way your bicep or your quadricep can. But there's no surgical billing code for teaching you neck exercises. There's no revenue in empowering you to solve this yourself. I had a patient. Her name was Margaret, 63 years old. She came into my office convinced she needed a neck lift. She'd already had 2 consultations with cosmetic surgeons. Both quoted her between $12,000 and $14,000. She wanted my medical clearance before scheduling the procedure. I asked her one question. Have you tried strengthening the platysma? She looked at me like I'd spoken a foreign language. She had no idea the neck even had a muscle you could exercise. I gave Margaret a protocol. 5 exercises. 5 minutes per day, no equipment, no cost, just targeted activation of the platysmal complex and the supporting muscles of the lower face. She left skeptical but willing to try for 2 weeks before committing to surgery. 14 days later, Margaret sent me a photo. The platysmal bands were visibly reduced. The skin under her jawline had regained tension. The horizontal lines across her throat had softened, not eliminated, softened. By week 4, the improvement was undeniable. By week 8, she canceled the surgical consultation. She didn't need it anymore. She had rebuilt the structural foundation her neck had been missing. This is not magic. This is not a miracle. This is basic exercise physiology applied to a muscle group that almost no one thinks to train. And the reason no one thinks to train it is because the cosmetic surgery industry has spent 40 years conditioning people to believe that aging facial anatomy requires surgical intervention. It doesn't. It requires muscular rehabilitation. Now the complete protocol, step by step, morning, midday, and evening. These 5 exercises target the platysma, the digastric muscles beneath your chin, and the masseter and temporalis muscles that provide lateral support to your lower face. You will perform them in sequence. You will do them every single day, and if you execute them with precision, you will see visible change within 2 weeks. Exercise 1, the platysmal resistance press. Sit upright with your spine straight. Tilt your head back approximately 15 degrees. Place both hands flat against the front of your neck, fingers pointing toward each other, covering the area from your collarbone to your jawline. Press firmly but not aggressively. Now try to bring your chin down to your chest while your hands resist the movement. You're creating isometric resistance. Your neck muscles push down, your hands push up. Neither wins. Hold this contraction for 6 seconds. You should feel intense activation in the front of your neck. Release slowly. Rest for 4 seconds. Repeat 10 times. That is 1 set. Exercise 2, the jaw jut and hold. Sit upright. Push your lower jaw forward as far as it will go. You're jutting your chin out like an underbite. As you do this, you'll feel immediate tension under your chin and along your jawline. That tension is the digastric and mylohyoid muscles activating. These muscles form the muscular floor of your mouth and provide critical support to prevent jowling and submental sagging. Hold the jutted position for 8 seconds. You should feel a burn. That burn is muscular fatigue. That fatigue is growth stimulus. Release. Rest for 4 seconds. Repeat 12 times. Exercise 3, the ceiling tilt and swallow. Tilt your head back and look directly at the ceiling. In this position, your platysma is already under stretch. Now, perform an exaggerated swallow. You'll feel the muscles in the front of your neck contract powerfully as they pull against the resistance of the tilted position. This is one of the most effective isolated platysma activations you can perform. Hold the contracted position at the peak of the swallow for 5 seconds. Release. Return your head to neutral. Rest for 3 seconds. Repeat 15 times. Exercise 4, the vowel exaggeration series. Open your mouth wide and say the vowel sound E with extreme exaggeration. Pull the corners of your mouth back toward your ears as far as they'll go. Hold for 3 seconds. Now switch to O by pursing your lips forward as tightly as possible, as if you're trying to kiss something 2 feet in front of you. Hold for 3 seconds. Alternate between E and O 20 times. This activates the orbicularis oris, the buccinator, and the risorius muscles, all of which provide lateral tension that prevents the platysma from banding medially. Exercise 5, the chin lift against resistance. Place your thumbs under your chin, pressing upward with moderate force. Now try to open your mouth while your thumbs resist the movement. Your jaw pushes down, your thumbs push up. Create maximum effort for 7 seconds. You'll feel this intensely in the suprahyoid muscle group directly under your chin. This is the area where most people accumulate submental fullness, what's commonly called a double chin. Strengthening these muscles tightens the entire area. Perform 8 repetitions. That is your complete protocol. 5 exercises. Total time, 4.5 to 5 minutes. You will perform this sequence once in the morning immediately after waking and once in the evening before bed. Why twice per day? Because the platysma is a small, thin muscle with limited glycogen storage. It responds better to frequent low-volume stimulus than infrequent high-volume training. Here's your timeline. Within the first week, you will feel the muscles activating more easily. The exercises that felt awkward on day 1 will feel natural by day 7. That's neuromuscular adaptation. Your nervous system is learning to recruit these muscles efficiently. By the end of week 2, you will see visible reduction in platysmal banding when you tense your neck. The vertical cords will be less pronounced. By week 4, you'll notice the skin under your jawline feels firmer when you press on it. That's increased muscle density providing structural support. By week 8, the horizontal lines across your throat will have softened measurably. Other people will start noticing. They won't know what changed, but they'll tell you that you look rested, healthier, younger. Now, critical warnings. If you have a history of TMJ disorder, temporomandibular joint dysfunction, do not perform the jaw jut and hold or the chin lift against resistance without consulting a specialist. These exercises create load on the jaw joint and can exacerbate existing dysfunction. If you experience clicking, popping, or pain in front of your ears during these movements, stop immediately. If you have cervical spine issues, herniated discs, chronic neck pain, or a history of whiplash injury, do not perform the ceiling tilt and swallow or the platysmal resistance press without medical clearance. These exercises place the cervical spine in extension under load, which can aggravate structural problems in the neck vertebrae. And most importantly, if you notice a new lump, a persistent swelling, or asymmetric thickening in your neck that doesn't resolve with exercise, see a physician immediately. That is not muscular adaptation. That requires clinical evaluation to rule out thyroid pathology, lymphatic involvement, or other conditions requiring medical diagnosis. This protocol works for age-related platysmal atrophy and skin laxity. It does not address genetic anatomical variations, significant fat deposits requiring liposuction, or severe elastosis requiring medical-grade skin treatments. Know the scope. This is muscular rehabilitation, not surgical correction. Here's what the cosmetic surgery industry will never admit. Muscle is cheaper than surgery, muscle is safer than surgery, and muscle, once built, maintains itself with minimal ongoing effort. A neck lift lasts 7 to 10 years before revision is needed. The platysma you build through these exercises will stay strong for as long as you continue loading it 3 to 4 times per week. Maintenance requires far less than the initial building phase. Margaret's outcome wasn't unique. Over 15 years of practice, I've watched dozens of patients reverse visible neck aging through targeted facial exercise. The ones who succeed share one characteristic: discipline. They don't do the exercises when they feel like it. They do them every single day, the same way they brush their teeth. It becomes automatic, and the results become permanent. The system you rely on for your aesthetic concerns is not built to empower you. It's built to extract maximum revenue from your insecurity. A 5-minute daily exercise protocol generates $0 for the medical industrial complex. A $15,000 neck lift generates substantial profit. Which one do you think gets promoted? How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers, because it will directly shape what I cover in future videos. And if this information gave you a real alternative to expensive cosmetic procedures, hit that like button and subscribe to Dr. Waterling. Every subscriber moves us closer to 1,000, and every view tells the algorithm that people want information that actually serves them instead of corporate profit models. Your neck is not a verdict. It's a muscle group that's been neglected, and the day you start training it with the same intention you'd train any other muscle, everything changes. Not someday, not eventually. In 2 weeks, you'll see it. In 4 weeks, you'll feel it. In 8 weeks, other people will notice it, and you'll have done it yourself with zero cost, zero risk, and complete control over your own biology. That's the principle this channel stands on. You are not helpless in front of your own anatomy. You just need to know how it works and what to do about it. Now you know. Now do it.